On Medical Montana today, I'm back at Rocky Mountain Vein Clinic here in Great Falls, talking to Dr. Orcutt. It's good to see you again.
Good to see you.
I want to follow up on something we've talked about, and that is that people can be reluctant to treat their veins. First of all, the symptoms can be hard to diagnose, but then I think that there's some fear because of some of the ways that this has been handled in the past.
You know, Tim, in the past, the only option we had for treating varicose veins was an operation called vein stripping, which is an operation that required a trip to the operating room, general or spinal anesthesia, and quite a bit of pain associated with it and a very long, painful recovery. And we don't do that anymore. But almost everyone knows somebody who has had a vein stripping or knows somebody that had a vein stripping.
Yeah.
So there are some preconceived notions about treatment for varicose veins. But those days are long gone. The techniques that we use here in the office, even for the most severe varicose veins, are all minimally invasive and extremely well tolerated. It's natural for our patients to come in with some anxiety. I expect that, it's common.
Sure.
And I try to inform them as best I can before we do any procedures as to what to expect. And still, patients are always a little bit anxious.
Sure.
When we finish those procedures, almost universally, patients will say, "Oh, that wasn't anything like I expected. That wasn't bad at all." So that's a very typical response when we finish our procedures.
Quite a change from what it used to be. Even the sound of vein stripping is just terrible.
It's terrible.
But the fact that this is now outpatient, I think, is a huge opportunity for people so that they don't ignore the pain and get in here and see you.
Patients are not exposed to any hospital-based treatment. Don't get me wrong, the hospital is the best place to be when you need to be there, but if you can have your procedures and your care provided outside the hospital,
Sure.
It's to your advantage.
Wonderful. Okay, well, we know they need to come to Rocky Mountain Vein Clinic if they're experiencing any of this discomfort or symptoms. Thank you, Dr. Orcutt. Appreciate it.
Thank you.